orthodontist has suggested they come in. Maybe they just want to have their youngster evaluated, and they have what's called mixed dentition. My mixed dentition, it means you have some baby teeth and some permanent teeth. It's a mixture. And I try to help them with getting the teeth to go in the right spot, because sometimes teeth don't want to go in the right spot. You either have what I call defective baby teeth, where the roots don't melt away like they're supposed to, or they've just got teeth that are forming in odd ways. And you see in this little girl's situation, she's got a tooth that's trying to lead sideways. It should be at an inclination. Instead of being like this, it should be more like this. And so what we've done is we suggested, okay, what I feel like we need to do is let's put in a space maintainer so we won't lose any space, and then send you to the dentist and we'll have certain teeth removed. And we go on to the next x-ray film here. And you can see, first we just had this baby tooth and that baby tooth removed. And this has turned some, not a whole lot, but some. And now you've got this tooth, which you'd have to be used to viewing these films, but this tooth, instead of laying like this, it's laying, it's sideways. It's turned sideways. So by not being in its proper position, but it being in a position like this, it's taking up more room than it should. And so consequently, these eye teeth still weren't quite going as well as we would like for them to. So we'll go on to the next film. You could notice on that last film too, there we go. You notice we cut off the edges of the film, so less exposure from radiation. And we trimmed it down. And so we're going to the next one. So we had the baby tooth that she would have been here and here in, and this is the patient moved over here. But the teeth are starting to come into a better position, but I mean, these teeth are markedly improved in their position insofar as they're not laying on their side, they're more vertical. And so they're headed toward the right spot. And so that's what we do a lot of. We're not trying to say, okay, every person that's 8 years old have to have braces, because we don't believe that, but we do think that some kids need early treatment with braces, and some people just need a little intervention. And we're trying to put in an appliance. The dentist removes the baby teeth, and things get better 99% of the time. And so that's what we talk about, guided intervention. Do a lot of this. Do much more of this than I do, putting brackets on youngsters that are 8 or 9 or 10 years old. Although we do some of that, but not the majority of the patients really need that. So we try to do what we call guided intervention, and we're just trying to make it so that as the teeth come in, they come into a better position, so it's a whole lot easier for the orthodontist and for the patient to deal with.